Imagine two people in the same city, an elderly uncle and a young mother. Both walk into the clinic with the exact same dental issue. The dentist gives them the same treatment plan. But 3 weeks later, the uncle has finished his care and is healing well, while the young mother has missed her appointments and dropped out of the system entirely. This happens because of the social determinants of health, the specific conditions in the places where these patients live, work, and age that dictate how easy it is to stay healthy. There is a difference between a simple inequality and a structural inequity. An inequality is just a difference in a data point. An inequity is a roadblock built by society that prevents a person from accessing the same resources as everyone else. For some, the roadblock is physical distance. If the nearest clinic is miles away in a rural village, geographic isolation alone makes it difficult to maintain a complex treatment plan. For others, the barrier is economic. In a crowded urban apartment, the daily pressure of high rent and job insecurity can make a dental appointment feel like a luxury that's impossible to afford. A dentist can perform a perfect procedure in the chair, but that hard work is lost if the patient returns to a life that actively prevents them from staying healthy. To navigate these roadblocks, patients rely on social support. This is the practical help that allows a person to actually use the healthcare system. First, there is emotional support. This is the friend sitting with an anxious patient in the waiting room, providing calm needed to step inside. Then there is informational support. Healthcare can be confusing, so this often looks like a neighbor explaining clinic rules or helping a patient translate a dentist's instructions into plain language. Finally, there is instrumental support, the physical help needed to show up. This could be a family member providing a ride to the clinic or paying for the taxi fare. These networks are not just nice to have, they are structural bridges. Without them, even the best clinical care remains out of reach. When those support bridges are missing, the resulting isolation and stress trigger a change in the body's internal chemistry. This diagram shows the HPA axis connecting the brain and adrenal glands. Without social support buffering pressures, it stays active, flooding the circulatory system with cortisol. This cortisol reaches the mouth, slowing saliva production. This causes dry mouth, removing the teeth's primary natural defense. Saliva normally cleans the teeth and neutralizes acids. When it disappears, the mouth becomes a high-risk environment for cavities and gum disease. Social isolation creates the biological conditions for rapid decay, proving that a strong community is a physical requirement for a healthy mouth. Beyond the biology, chronic stress also severely drains a patient's mental energy, making simple daily hygiene routines feel completely impossible to manage. We call this mental energy self-efficacy. It is the internal battery power required to perform healthy habits every single day. When that battery is drained by the struggle to survive, patients often turn to high-sugar foods. These provide a quick, cheap burst of comfort and energy during an exhausting day. At the same time, the routine of brushing and flossing often falls away. When life is a series of emergencies, preventive care feels like a task that can always wait until tomorrow. For a patient in survival mode, dental habits are often the first things to be sacrificed to make it through the day. As a dentist, you can choose to look beyond the clinical symptoms and address these roadblocks directly. You can work with community health workers, trusted members of the neighborhood who help patients navigate the system and find the support they need. You can also use social prescribing. This is when a dentist refers a patient to local services for help with housing or food, treating the source of the stress that is damaging their teeth. This network shows interprofessional care. It happens when the dentist works alongside physicians and social workers to build a complete support system for the person in the chair. Helping a patient secure their daily life is a vital part of ensuring their dental treatment actually succeeds in the long run. In the past, dentistry was treated like an assembly line, where patients were seen as broken parts to be fixed and sent away. But the reality of care happens here, in the community, where our patients live complex lives. The young mother who couldn't finish her care wasn't a clinical failure. Her treatment fell apart because her social foundation was under too much pressure. To be truly effective as a provider, you must treat the circumstances of the person, not just the physical cavity. By taking these steps, you ensure your clinical work stands on a solid foundation, making you a cornerstone of community healing.